think it's because you guys came on a non-regular ops hour day. Mondays and Thursdays are just crazy. It's like insane. There's like people running in and out of here. And I had to hold that for a second.
No problem.
You having a lot of pain or discomfort?
On the right side, kind of like when I was binding and like my nipple would get pinched in the binder funny.
Yeah, that's probably.
It was like kind of like that on this side.
And we're gonna take this off here in a second. And we'll walk around you about 20 times. This is a big old face bandage. I'm gonna save this for you too. This still looks pretty clean, so you can wash it if you need to. If you ever need it for anything else, if you get any swelling, you can just use it again. These things are expensive, so I would say one of these too.
Wrap Kevin's head in it later.
No.
Oh gosh, I can breathe again.
I feel a lot better. Setting that off right there.
Aw, him with diapers on his chest.
Leave it to you, Catherine.
We'll get you some Depends tape on
Feels
that.
so weird though.
Do some of this tape. This tape is going to kill you, sorry about that.
It's alright. Oh look, your favorite chest hair got to stay.
Yay!
Let's get the charm up a little bit higher there. It's going to stuck on her. Okay.
There it is.
Alright.
SpongeBob SquareNipples.
Okay, let's go over all this here. You got some swellings on. You can kind of see that with the rippling of the skin. Just all smooth itself out over the next couple of months. These tape strips, they need to stay in place. Okay, take these off next week. Okay. We did have to join the center because obviously I remember we were talking about that. There's a lot of excess skin in the center. Nipples where it should be. It's right where the lower border of the pectoralis muscle is on both sides. Okay. Now out here, lift your arms out. I mean, you do have all this excess skin, which we had talked about before, and I try to remove as much as I can, and also lipoid. So it's probably a little bit tender when I touch right there. That's expected, but again, there's just only so much you can do as it goes all the way around towards the back. But don't worry, I think it's it'll look pretty good. Okay. Aside from that, it looks very good. All right.
Amazing.
Okay.
So the strips should be taken off, not left on until they fall off.
Well, you can do that, but if they don't fall off by next week, you can go ahead and take them off.
Okay.
That's okay. All right. So I'm gonna kind of scoot back, move your tush back as far as you can. Okay, and just lean back, and I'm going to lay back, okay? You can put those on. Thanks, I'll go down. Push it. Go ahead and push there. There you go. You got it. Okay, that's good. Alright, so just stay right there. What we're going to do is we're going to take the drains out first.
Ew.
Fun stuff.
Cookie gookie.
I just want you to relax your arm back just like this, okay? Okay, I'm going to be walking around, so...
Sorry, I'll stay
that's
over
your
here.
best spot.
I'll stay over here.
It's like the videotaping corner. You know, like this. Okay, so what I'm going to have you do is take a deep breath in and blow out as hard as you can that way. Away from this deep breath in, blow out hard. There you go, like that. Drains out. Okay?
How much of that was in there?
Oh,
Ew.
yeah, about 12 inches.
Fun stuff.
Creepy, huh? Alright, we'll do the same thing, okay? I want you to take a deep breath in, blow out as hard as you can. There you go, it's out.
And where does it go? Like, does it go up around the front, or like where
It's just
is
underneath.
it in
It
there?
basically runs just underneath where the incision line is, because that's where all the fluid will eventually fall down to anyways.
Okay.
So it just collects all the excess fluid that builds up. Now I'm putting a little gauze here with some antibiotic ointment on it to cover those holes. You need to get yourself some Band-Aids. I recommend getting the big square Band-Aids. Put some Neosporin on the Band-Aid, cover the hole, change it at least once a day. It takes a few days for the hole to close up. You're still going to get some leakage from that area for the next couple of days. Don't worry about that, okay? will eventually stop. This one out, just right there. Okay, now you can bring your arms forward, just kind of like that. All right, now we're going to take your nipple graft dressings off. And the nipple grafts always look really ugly initially, okay? You're probably going to see this 1,000 times on the internet. But there are lots of different colors, lots of different shapes and sizes. What I do cut, it's a 2 centimeter template, okay? The outer layer of skin is going to be multiple colors. Over the next week, it's going to peel away. It's going to be raw underneath. And then what's going to happen, new skin cells will grow around top. The center part of the nipple graft, where the projection is, that takes the longest to heal. It can take almost 3 weeks to heal sometimes in certain patients. I'll teach you how to do the dressings here in a little bit. It's okay for you to start showering tomorrow also, okay? But when you take your shower, the water hit your back and then run over in front of your chest, okay? All right, so this is live, okay? There's these little brown sutures around the periphery, okay? Those are going to fall on their own, so don't touch them, okay? Those little sutures want to come out. It's all on. There you go. Okay. Is it hurting?
Not really. I was afraid there was something wrong with that one because it kept hurting on that side. I'm like, oh god.
No, what's happening is just that sometimes it pulls on a little suture funny or whatever.
It's like opening a present. Close up of nipplage.
Somehow I doubt anyone wants to see that.
You will.
This one looks good too, okay? They're both alive.
Way to go, boys.
Well, just like you, they're tenacious little bastards. So you can cut us off and stick us back on. We don't care.
Yeah, the nurses at the surgery center gave me something after I woke up, and she's like, I can't believe you're still awake. You should be knocked out. I'm like, I'm ready to go. She's like, well, we can't let you go for 2 hours. I was like, alright. So they just let Chris and Krista and Catherine come back and sit in the corner with me for 2 hours.
Alright, everything looks good in the line.